So today we have a few goals. We're going to do a general focus on the ear, hearing and its relationship to tinnitus. We always do this as a general foundation so patients can understand what part of the body and what specific part of the ear we're going to be focusing on. We're going to focus on the causes and contributing factors of tinnitus. We'll be getting into a lot of those. Understanding how tinnitus can impact your life. That's most likely why many of you are here. And also we're going to do a nice overview of different tinnitus treatments. As there are many different ways to work with tinnitus, we do want to give you a good understanding of some of the options. However, again, for your specific case or specific instance, we would like to work with you directly. We will have the Q&A section of the Zoom chat available. One of my colleagues, Dr. Courtney Siri, will be handling any questions. If there's a question that she thinks we should forward on, she will forward it to us for discussion. Please feel free to ask any questions that you'd like. Again, please stay away from any any focused questions about your specific instance. So if it's your individual case, again, please refrain from asking those questions. And if at the end of the presentation, we'll be more than happy to answer any questions that you have. Again, on the surface level, any specific individual cases we will most likely be avoiding at this time. But at any future appointments that you have with us, we will be more than happy to work with you.
You should see a Q&A section at the bottom of your Zoom. If you've got a question, go ahead and click on that, ask your question, and we will answer those as they come in. Okay.
Absolutely. So Dr. Fuller is going to give us a nice anatomy lesson. Again, prior to any sort of discussion on tinnitus, we like to understand what the ear is about. So Dr. Fuller, after you.
All right, so this is kind of a view of the ear from 10,000 feet. You know, we've got the ear here, kind of what we traditionally think of as the ear, but keep in mind, hearing is more than just the ear. It's also involving the brain. The ear is really just a conduit to get the sounds to the brain. So let's kind of dive into the different parts of the ear itself. So to understand tinnitus, it's actually really important to understand how the ear functions. Going from the outside in, we first have the outer ear. We have the ear here, or what's commonly known as the pinna, you know, what we think of when we think of the ear. We also have the ear canal, and then the eardrum. Those three things make up the outer ear itself. Then we have the middle ear. This is that air-filled space that includes those really tiny ear bones. They're actually the smallest bones in the body, more commonly known as the hammer, the anvil, and the stirrup. And then, of course, we have the inner ear. This is what we refer to as the hearing organ. It's the job of this piece, the hearing organ. Its job is to really take sound and turn it into a language that the brain can understand. Now, when it comes to hearing loss, each part of the ear is crucial in maintaining a healthy hearing. And there's a couple of different types of hearing loss that we can come across, one of which is conductive hearing loss. This could be caused by anything from ear wax, which would cause a temporary hearing loss, a pretty minimal hearing loss. We could have a perforation in the eardrum, or, you know, that's a fancy way of saying a hole in the eardrum, whether that be from, you know, using a Q-tip or, you know, an ear infection that caused that hole in the eardrum. Or we could actually have some trauma to the ear. You know, we can break those tiny little bones in the ear, which can cause some hearing loss. You know, any breakdown in this system would impact the way sound waves are transmitted to the ear or conducted from the outer ear to the inner ear.
Right, and so when we discuss conductive hearing loss in the office, a conductive hearing loss is the only style of hearing loss that can be treated via surgery, treatment such as wax removal or medication. So when a patient comes into our office and says, well, is there a medication to cure my hearing loss or treat my hearing loss? And the doctor says, yes, we would be focusing on a conductive hearing loss.
The other type of hearing loss that we can encounter is a sensory neural hearing loss. This occurs within the inner ear, and it really happens when the supporting cells are weak or they're damaged or diseased. And this results in an incomplete signal being sent or transmitted to the brain. This is what accounts for a number or a majority of types of hearing loss.
Right, and when we hear the term sensory neural, audiologists such as myself would like to cut that word in half. We like to focus on the word sensory. A lot of patients will come in and say to us, well, doc, do I have nerve damage? The reality is we actually have sensory damage. The sensory organs of the ear are what is damaged as opposed to the nerve per se. So we're actually talking about damage to the ear. So we don't have nerve damage, we have damage to the sensory component of the ear. So which leads us into why you're here. What is tinnitus? So tinnitus, yes, it can also be pronounced tinnitus, although most medical professionals will use the word tinnitus. Please just avoid using extra syllables. In the office, our patients will say tinnitus, and there's a lot of extra words and syllables. Tinnitus or tinnitus are both our acceptable pronunciations. So tinnitus is basically a perception of sound when there is no sound available. It may happen in one ear, the other ear, or both, or even you might just find that it's centrally located. Tinnitus can come from many different locations and causes, which we will focus on shortly. And we hate putting this statement, but currently there is no cure for tinnitus. However, there are a lot of therapy options and treatments that will provide you relief and make you much more comfortable working with your tinnitus. So again, there is no current cure for tinnitus. Mm-hmm. So we've discussed, unless Dr.
Oh, no. I was just going to say that it is, we commonly call it as ringing in the ears, but it can be more than just ringing. It can be buzzing, it can be humming, it can be whooshing, it could sound like the ocean. So there are many different quality of sounds that you can experience when you have tinnitus or tinnitus.
And having said that, when you come into the office and you discuss your situation, whatever you are experiencing is legitimate. So a lot of times we'll see a patient who comes into the office and they'll say, I was diagnosed or my doctor told me I had ringing in the ear. And I'll follow up with, well, do you have ringing in the ear? And they'll say, no, I have buzzing or chirping or whatever. Any one of those sounds is defined as tinnitus. But what tinnitus isn't? So I think a lot of patients will come in and they'll say, well, I have this problem of ringing in my ear. And a lot of doctors, a lot of medical professionals will diagnose you with tinnitus. The reality is that tinnitus is not the diagnosis. It's actually a symptom of something. We'll get into the somethings in a moment, but just understand that tinnitus is not the diagnosis. We get tinnitus from whatever reason, and we'll get into those, as I said before. It doesn't result from a disease process. A lot of people, when they have tinnitus, the first thing that they think is something is wrong. The reality is that the auditory system is using a compensatory strategy. It's actually presenting a sound to assist us when there is damage to the ear itself. So it's actually a normal occurrence. And in fact, 94% of the population in some studies report spontaneous tinnitus. So even though you have normal hearing, once in a while you may actually just have a ringing, buzzing in the ear, and that's okay. The other component is my last 2 points. Tinnitus does not cause hearing loss, and hearing loss does not cause tinnitus. Though they're located in the same region, obviously our ear, a person can have hearing loss without tinnitus and the other way around. So when we see you in the office, we are going to be assessing for hearing loss, but if you don't have hearing loss, you can still have tinnitus.
So let's talk about some of the facts about tinnitus. If we look at the facts and the statistics, around 50 million Americans experience tinnitus. About 30% of those who have tinnitus seek medical attention, and about 4% of those feel seriously disabled by their tinnitus, in that their tinnitus is impacting and interfering with their life. What's interesting is if we just kind of ask the general population if they experience tinnitus, about 15 to 20% of people will say yes. But if we ask that same question to those with hearing loss or hearing impairment, that number jumps up to about 70 to 85%. So 70 to 85% of the hearing impaired population do experience tinnitus.
And again, as these numbers indicate, there are plenty of people who experience tinnitus, but it's a positive that if we break down out of that 50 million people who experience tinnitus, only 2 million are seriously disabled, and that should give you as a patient hope in terms of how we address and treat tinnitus, which again we will go through shortly. But just understand again that many people can be helped effectively.
Mhm. Okay, so that moves us to some of the common causes of tinnitus. And like we said, there are hundreds and hundreds of causes of tinnitus. Today, we're just going to kind of talk about some of the more general or more common causes of tinnitus, one of which is auditory trauma or damage to the ear. Again, there is a very strong relation between hearing loss and that ringing in your ears, but also certain things like exposure to loud noise, whether that be a gradual exposure over time, say years of listening to loud music or working around loud noises, that could cause tinnitus. But the same with a one-time incident of loud sound, like being around a firecracker or explosion or a gunshot, that is also highly associated with tinnitus. Of
And
course.
for many people, as we see this list, which actually it's not expansive, there's a lot more than that. Just know that for many of you, if you say yes, that's me, or I had an accident where my ear was damaged, or something, you have your why. And I think that's one of the most important components with tinnitus. For many patients, they want to know why. And I think once we do a case history and discuss, uh, did you have an accident? Was there a surgery? Did you have some sort of event, a trauma to the head, a concussion, anything of the sort? We'll have the why. And I think for many people, that will be a first step into recovery with tinnitus, because I know it's cliche, but the first step is understanding it. So once you understand the why, we can then move forward into working with you to improve your situation.
Mhm. Exactly. And with that, it is very important to include a medical evaluation and consider all of these factors when we are looking to treat the tinnitus.
Mhm. And you will see at the bottom on the right there, it says side effects of medication. I just would like to point out one little thing. A lot of patients have asked me about aspirin. Actually, most of the research indicates that taking aspirin is okay. It will not generally increase your tinnitus. A lot of the research indicates you would have to take approximately 35 aspirin in a given sitting for it to have some sort of effect. So please don't be afraid to take aspirin in the event that you need it. So moving forward.
Moving forward, we've got some of the common struggles of tinnitus. So it's important to note that everybody experiences tinnitus differently. There's no way to predict how one person will react to their tinnitus. When we're doing evaluations, we like to look at certain aspects like the loudness of your tinnitus, the pitch of it, the how long it lasts, if it's constant or if it's only sometimes. If we can you know look at that duration. There's no way to really predict how one person will react to it. But a lot of the common struggles with tinnitus include, difficulty sleeping, either falling asleep or staying asleep, general annoyance and irritation, difficulty relaxing, especially in quiet environments, feelings of despair and frustration, focusing in on speech and being able to concentrate, as well as just general stress. So it's important to kind of take this on a case-by-case basis because, again, there's no way to predict how someone will react, and there's varying levels. It doesn't mean that it includes all of these factors. It could be some of these factors or none of them.
And focusing on the statement where it says focusing on speech and conversation, we do see a lot of patients who will come in and inform me that they can't hear because of their tinnitus. As noted before, one does not cause the other, but the general focus that we place on tinnitus does not permit our brain to focus on anything else. Fundamentally, our brain is only able to consciously handle one task at a time. And for many of those who are suffering from tinnitus, focusing on the tinnitus does not permit us to essentially function. And that's where, again, those common struggles arise. Now, transitioning a little bit into something a little bit more current, COVID-19 and tinnitus. We brought this slide together recently because we've been asked, and we've had plenty of patients who have noted that they were recently diagnosed with coronavirus, and tinnitus was one of the side effects. There is a link between COVID-19 and tinnitus. One of the more recent studies, as noted there, says 40% of people who had symptoms also experienced a worsening of their symptoms. 15% of this hospitalized population reported hearing impairment as well. So we do want to understand that, yes, tinnitus is a possibility with COVID-19. However, if you suddenly get tinnitus today, please don't start diagnosing yourself with COVID. So PSA for you there. We do want to note that COVID generally causes an increase in the platelets, and that gets stuck in the blood vessels in the ear. So if there is a blockage in the pathway, there can be trauma to the ear, which results in decline in performance, which can result in tinnitus. We also did just recently note that there is no research on the vaccine and tinnitus. Currently, some anecdotal evidence. However, we don't have any research studies that say whether you take Pfizer, Moderna, or the upcoming Johnson & Johnson vaccine will result in tinnitus. However, one of the other components associated with this is the impact. As Dr. Fuller noted before, there's a lot of emotional struggles. And you'll see when we look at this list, stress and fear and financial concerns, it's pretty much the same thing that is associated with general tinnitus. So over the last year, I have seen countless patients who are coming in because they have been reporting that their tinnitus has worsened. And it doesn't sound very medically professional to explain it to them, but however, the pandemic impact is most certainly having an impact on perception of tinnitus. Many people are staying at home, not going to environments with excessive background noise. So we're basically left in quiet environments such as our home. For many of us who are living alone, or who have large houses with that are very cavernous, what'll happen is we'll start noticing anything that's quiet. For many of people historically, it's been creaky floorboards or a new refrigerator or vent or fan. Now it's our tinnitus because that's all we're left with. And while that's very frustrating, it is something we are seeing very commonly today.
Mm-hmm. And if you just kind of consider how the general population is reacting to this pandemic, we've already got the stress of tinnitus, and now we have this added layer that's adding to it and really exacerbating everything. We're also turning to a lot of those comfort foods to kind of get us through that pandemic. And what's kind of the catch there is that a lot of those comfort foods can really exacerbate tinnitus. So salty foods, increased caffeine, we're drinking more coffee, alcohol use can exacerbate that tinnitus and make it louder. So all things to keep in mind.
However, yeah, just we don't want you to stop drinking coffee. We don't want you to stop eating chocolate or potato chips. However, when we ask patients about their consumption, this is a cup of water. So when we ask patients, how much coffee, and they say a cup, it doesn't necessarily mean this. We've seen some of those 96-ounce jugs, and they define that as a cup. So just be conscious about the amount of consumption. Potato chips are okay. If you eat 2 bags of large potato chips, we might have a little bit of a problem.
Mm-hmm. But let's take a little bit of a closer relationship or a closer look at that relationship between stress and tinnitus. So, if we take a general look at the auditory system, earlier we talked about how sound is captured by the ear and it sends that sound to the brain where it's interpreted. That sound goes to the auditory cortex. That's where sound is really interpreted. And there's a strong connection from this auditory cortex to the limbic system, which really controls all of our emotions. This is where sound will be determined as relevant or not, acceptable or not, strange and unwanted or not. This is the part of the body, this is the part of the brain that tells your body to wake up when you're sound asleep and you hear something unexpected in your house, like the floor creak. It's also what grabs your attention when you hear things like a police siren. So,
And that, yeah,
oh,
and that would
sorry, go
lead
ahead.
into, yeah, just waiting for that slide to move. You can go ahead, Cassie.
Oh, I was just going to note how, tinnitus and stress are highly correlated. We have our stress increase and our perception of our tinnitus increases, and then that increases our stress some more. And it's just kind of a slippery slope, a vicious cycle. Fear and anxiety is highly associated with tinnitus and stress.
And for many people, even professional intervention doesn't necessarily get us out of that proverbial cycle. For example, this is a goofy example, but one that'll kind of demonstrate the concept. So let's say you came into my office and strangely enough, while we were talking about tinnitus, there was a tiger sitting in the corner of the room. And you would most certainly be focusing on the tiger, ensuring that he doesn't eat you. And I would inform you that no, this tiger hasn't really eaten anybody in the last month or so. He's very calm, he's very relaxed, don't worry about it. However, regardless of my professional explanation, general concept would be to focus on the tiger. So even though the signal I've defined as not important, you've defined that as an important signal and a negative one at that. So it's important to understand when we get in a little bit more into how we work with tinnitus, it's about understanding that tinnitus is not particularly a negative signal. It is not a negative concept. Unfortunately, we've kind of defined it as such. And when we do these types of presentations, one of our first goals is for you to understand that in most cases, tinnitus is not a negative signal.
Mm-hmm. Exactly. So, one of our most important goals in successfully treating tinnitus patients is to really break this tinnitus stress cycle and retrain the brain to learn that tinnitus is a neutral signal. It's not something to be alerted by. So, although we've mentioned there's no cure for tinnitus, there's no pill that we can give you, there's no eardrop that will, eliminate that tinnitus. Our focus in tinnitus treatment is really habituation. So, what is habituation? This is a process at which one adapts to a stimulus following repeated exposure. Um, we experience habituation thousands of times a day. So when you put on your clothing, your body habituates to it. When we put on a watch or jewelry, you put a ring on, your body may notice it there for a few seconds, but after a minute or two, you forget it's even there. Same with
And
hearing non-important sounds like, the air conditioner in the background. Your brain recognizes it as a non-important signal. It notices it as neutral, and it sends it to the background.
in fact, a lot of people will have issues with a lack of sound. In fact, they actually did a study in New York City years ago when they moved the subway lines. What occurred was that many of the people who had become accustomed to the sound when they removed the subway line from a specific location, there were a lot of phone calls and complaints. And the reason was because people thought that they were hearing things, but the reality was they've become so used to hearing a certain sound that anything that altered it was a problem. Another example of a lack of a habituation would be when we leave the movie theaters. A lot of people, the moment you leave a movie theater and you go out into the sunny day, the first thing you want to do is put your sunglasses on or cover your eyes. And what happens is the brain gets used to doing that. So that if you're a habitual moviegoer, what'll happen is the moment you leave the movie theater, you put your sunglasses on, your brain will never really adapt to the sun. So we want to get you to adapt to the proverbial sun. So, another example of habituation is focused on our candle. So if one was to walk into a dark room, they would notice the candle. The candle would be a focal point, and for many people would say, wow, that's quite bright. And our vision, our focus would be right on that candle. However, let's say we turn the light switch on. You'll notice that the candle doesn't look so bright anymore. And that's essentially the foundation of habituation. It's to create an environment where the signal is not so prominent, that it kind of fits into the background with everything else, that there's a mixing point, that there are a lot of different sounds that we'll be experiencing, and that none of them is more important than the other.
So using tinnitus habituation or using habituation to treat tinnitus, the goal is to get the brain to relearn that tinnitus is an unimportant and non-threatening event, thereby allowing the brain to kind of ignore or forget about its presence. And if we can reach that tinnitus habituation, it can relieve a lot of stressful things. You no longer feel helpless in the face of tinnitus. You're able to relax. It'll improve concentration. You'll have better sleep habits and sleep better. Overall quality of life can really improve if we can reach this level of habituation.
And longitudinally, as we've seen our patients over the years who have tinnitus, we'll ask them how they're doing. And many of them will say, yeah, my tinnitus is still there, but it's fine. And that works. We want to hear that's fine, or it doesn't bother me, because then we know that we can focus on the more important things, such as appropriate communication and obviously the basics of living our life and things such as sleep.
Now, how do we reach this level of habituation with tinnitus? Well, we take a multifaceted approach. It's really important to incorporate a lot of different things to really reach this and tailor it to each patient. Because as we said, everybody's going to experience tinnitus in a different way. We really recommend, oh, sorry, go
Sorry to
ahead.
interrupt, but yeah, and I think that's a big take home point. We will go down whatever pathway we need to. And I think a lot of patients with tinnitus are looking for that cookie cutter treatment. There is no cookie cutter treatment. I've seen one tinnitus patient. That means I've seen one tinnitus patient. So what we do is based upon what Dr. Fuller will discuss, we'll create a plan for you.
Mm-hmm. And a lot of times those plans include some counseling and education about tinnitus and different strategies on how to cope with tinnitus, some relaxation strategies to kind of reduce those stress levels and, get the brain to relax a little bit and ease off that limbic response. And also marrying that with technology. So for those patients who have hearing loss, amplification is a really great solution. That's very important, a key factor into treating that tinnitus. Amplification is just a fancy word of saying hearing aids. And also integrating sound therapy when necessary.
And for many people, the counseling is huge. And obviously that's why we're here today. There's a big effort to start hunting on the internet or try to find what WebMD says. I think it really needs to be individualized to the patient. So when you come in and you discuss your specific case and we assess your hearing and other components, then we can kind of tailor it to that counseling to you. Because some of the examples that I'll be giving today, or some of the examples I've already given, may not be relevant to you, and that's okay. But it's important to know that we have that ability to focus on what's working, what's not working in your auditory system, and try to work with it. So a lot of that starts with appropriate counseling.
Mm-hmm. Now, when it comes to the technology aspect, there are some great tinnitus management tools out there. We could use a sound generator, that would induce some sound therapy to help with that tinnitus habituation. You could use a hearing aid if hearing loss is your primary concern. Tinnitus is kind of just, secondary or, not as important. You could go with amplification if you do have hearing loss. But at Widex, we like to bring the two together. We make what's called combination devices that have that sound therapy available, but it's also a hearing aid. So you kind of get a two-in-one device, which makes that transition very easy. It makes that tinnitus habituation very simple.
And for many patients that come into the office, yes, obviously Dr. Fuller works with Widex, but when we try various hearing aids, simply putting a pair of hearing aids on a patient's ear is a great first step. In our office, we demonstrate hearing aids, and the reason we do is, while we can't guarantee that placing a pair of hearing aids is going to stop your tinnitus, many patients do report an immediate reduction in symptoms or severity. It does give a patient hope. And for many patients, that is, again, another first step to improvement. So when the patient receives that extra stimulation, especially if they do have hearing loss, that stimulation from the hearing aid will give the brain something more important to focus on, such as many of the consonant sounds of speech that may be lost with, let's say, a high frequency hearing loss. Or for those with bigger hearing losses, just the awareness of speech in general to result in improved communication. So we can actually focus on what people are saying instead of that little sound that's going on in the back of our head. As for sound generation, it's one of the oldest ways to work with tinnitus. Open a window, turn on a fan, turn the television to a low volume, a static radio station. Any sort of sound is something to allow our brains to focus on something else. Now, one caveat to that, please don't present those sounds so loud. We want to create a nice mixing point, because what would happen is, let's say we turn the television on really loudly when we go to bed. What'll happen is we'll now focus on the television. And then, so we've lost the tinnitus, but now we've gained another problem with the loudness of the television. So it's really important whenever we use sound generators and when we discuss them in the office with patients, the goal isn't to turn the volume up to the proverbial 11. We want to make sure that we have a volume that's comfortable, that will assist us and relax us.
Now, what do we do in this sound therapy? Well, at Widex, we like to use music, basically. So who here likes to listen to music? I'm willing to bet that most of us do. Whether, whatever music you like to listen to, music is a universal thing. We all have a natural sensitivity to music, even if we don't know anything about it. You don't have to be a classically trained musician to like and appreciate music. And as humans, we live in an ocean of sound and vibrations. And because music is an organized sound, it actually engages the brain differently. For one, it engages nearly every aspect, every part of the brain. So if we take a look at some PET scans of the brain's reaction to music, it looks something like this. The brain gets very excited. We've got lots of activity when the brain is responding to music. In response to music, the brain fires neurotransmitters, and the body reacts to that response. So different types of music can actually have different responses and may ramp up the body in different types of ways. It can increase the heart rate, increase your respiration rates. It can change you both physically and emotionally. Hollywood likes to use this a lot. If you think back to some movies that you've seen, if you think of the movie Jaws and the kind of the emotional response that we get when you hear that dun dun. So the research shows that when we have tinnitus, and especially when we have tinnitus for a long time and it goes untreated, the brain can kind of misfire a little. It can cortically reorganize. So by using music to really stimulate the whole brain, we can really retrain the brain to respond to that tinnitus sound differently. We can really break the cycle of tinnitus with music. From a physiological level, music is known to result in a lot of changes. It can change our heart rate, our blood pressure and respiration rate. It can change our muscle tension. skin temperature and conductance. It can induce emotional responses, tears and chills, and it releases a lot of hormones. So the body does get a huge physical response to music. So the version of music that we use for sound therapy to promote tinnitus habituation is called Zen. Our goal is to really engage those neural structures to promote habituation without evoking a huge emotional response. Our goal is relaxation. So we want to engage the whole brain to really retrain the whole brain, but we want to avoid any of those emotional responses. So what we use are called fractal tones. And with these tones, we follow the rules of music. So it's very pleasing to listen to. It's very relaxing, but they never actually repeat. So you'll never be able to predict what happens next. You'll never kind of get used to it. We see fractals all around us. Fractals are snowflakes. Fractals are broccoli florets. Fractals are cheetah spots. It's a pattern that you recognize, but you'll never see two that are exactly alike.
And for many people that use those fractals, as someone who has worked with the wide X fractal tones, for many people, they do find a significant relief. And it doesn't need to, as I noted before, it doesn't need to be loud. The presentation just has to be mildly present to allow the brain to just have something else to work with. And for many people who are suffering with larger, more intense cases of tinnitus involvement, utilizing the hearing aid sound plus the fractal tones is a wonderful combination.
Exactly. So these fractal tones, this Zen therapy really does help break the cycle of tinnitus and stress. It's very pleasing to listen to, it promotes relaxation, and it activates the brain, but is not distracting. It's not going to interfere with your conversation. It's just something that's kind of there in the background that's very pleasing to listen to. It's very relaxing. It provides a great distraction to help you concentrate and really retrain and reorganize the brain to not have that negative stress response to the tinnitus. So
And
this
we
ultimately facilitates that habituation.
and we tailor that response to each patient. So within a lot of the tinnitus based hearing aids, we do see the opportunity to present different types of sounds. So some patients will respond more effectively to quicker presentation of tones, some lower pitched tones, some higher pitched notes. Some will just respond to the sounds of ocean waves. We can't, most hearing aids worth anything with respect to tinnitus do give that versatility to patients. So that way, if we're struggling, we can help it. If we're struggling in different ways, even for our more advanced cases, we may have to present multiple different types of fractal tones. And that can be utilized as a special program in the hearing aid that you can turn on and off, depending upon how you're functioning on a given day. Now, medications. So we were hesitant whether we wanted to include this slide, but it's a question that's asked very often. Currently, there's no medical evidence, there's no clinical evidence supporting the usage of any medication or supplement for the treatment of tinnitus. In your junk box in your email, if you look up tinnitus online, it'll result in you receiving countless treatments for tinnitus. Again, there's no clinical evidence supporting the usage of any of them. Any medication or supplement that one would use is basically designed to treat an overarching issue. So if a person comes in and says, I'm really depressed, I have tinnitus, and the doctor prescribes a medication for depression, they may come back and say, wow, my tinnitus is better. Well, did we really treat the tinnitus or did we treat the depression? So please be aware of that. That's a really important component, because when a lot of patients who are struggling and are nervous and are at their wits' end about tinnitus, they will go to a lot of doctors who will try to medicate them. And again, while medication has its purpose, and as an audiologist, I cannot prescribe medication, please understand that in many cases, the doctor is prescribing something that will assist with other symptoms, a la that depression, anxiety, sleep issues, and things like that. Just be aware, though, on the flip side, that some of those medications may actually have a side effect of increased tinnitus. So while when you read that bottle and it says may induce ringing in the ears, obviously consult your prescribing physician on that. Please don't just quit taking medication if you do have an increase in symptoms. Please go to your physician or the prescribing physician to discuss that. So take home points. We've gone over a lot in the last 40 or so minutes. Tinnitus is something that we can talk about for hours on end. As research continues on, we hope to be able to give you more information, and hopefully maybe one day there will be a cure. But for right now, while those millions upon millions, 50 million people in America experience tinnitus, and it happens on very different scales, there are proven treatments. As an audiologist, I will most certainly attest to the fact that I've seen many patients who, when they come in, they feel a certain way. And after treatment, whether it be sound therapy, sound generation, hearing aids, or even just basic counseling, that proverbial weight on their shoulders is lifted off. We can relax and we can focus on the important things in our lives, and we can get rid of that annoyance or that frustration that tinnitus can give to many of us. Allow a healthcare provider to work with you. Treatment is key. Please don't, again, look on the internet. Please don't just hunt for that magic cure or that magic pill, because right now that does not exist. Trust me, when that time comes, whoever invents it will be very rich and famous. But for right now, treatment is appropriate. And as Dr. Fuller noted, Widex, Zen, that's one of our major options that we can utilize. For those of you who have different brands of hearing aids, that's okay too. We're able to work with those as well if they do have any sort of tinnitus treatment component. Widex has actually been doing it the longest among the brands with respect to tinnitus treatment. In fact, when their Zen concept first came out, it wasn't actually allowed to be called the tinnitus treatment. I don't know if Dr. Fuller wanted to note that, but originally we just had to define it. It was for relaxation, but then it went through the FDA and it received a much higher rating. And now we can say that Zen is a tinnitus treatment. And that's great to know, because again, when we see our patients, there's something that we can do. Again, there's many things we can do. You just have to come on in and learn a little bit more about your own ears, learn about your situation, and hopefully we can help you. So if we can move to the next slide.
Yep, it's just moving a little bit slow.
No problem. And as I said, it's all about that education. So that's why I decided to choose this topic. Tinnitus is something that so many people ask about on a daily basis. I was talking to Dr. Fuller about it yesterday. My last 5 patients all had increased tinnitus over the last year. So please, utilize what's out there. Use a healthcare professional. Use an audiologist, use an otolaryngologist. If you need a neurologist, so be it. We want to be able to give you that opportunity to feel better. Obviously we'd like you to come to Coastal. We've been working with tinnitus for many years. We have many well-trained physicians and audiologists. Most certainly, I'd like you to see me if you are interested. So obviously, scheduling a hearing assessment with one of us would be beneficial. It would give us an opportunity to really understand your specific hearing loss, if you have hearing loss, and how it all fits in. We'll be doing various tests to learn about the strength and performance of your middle ear as well as inner ear, as Dr. Fuller noted before. We'll be able to really break down all of the parts, because if we see something that's not performing to its potential and we can improve it, we most certainly will. If the loss is focused around a sensory neural component, as we noted before, we'll focus on ways we can work with that. So with that being said, if you don't choose to work with me, we do have a great team at Coastal Hearing and Balance Center. We have 3 locations. We have Dr. Salerno, Dr. Siri, who has been handling our Q&A. So thank you for that, Dr. Siri, Dr. Parker, and Dr. Wall. So please be aware that if you aren't able to work with me, they're all more than capable of working with you on your tinnitus concerns. So obviously we lost that slide, there we go. to request that appointment. That's our main number and that's our website. So please be aware that we have 3 locations. I'm only located in our Neptune location. We do have audiologists again in our Homedale and Manahawkin location. So just understand that if you do want to work with us, Neptune is our largest location with the most availability for care. You can go to our website, coastalearnoseandthroat.com. So you can learn a little bit more. We did have a little bit on our website about tinnitus as well. And if you do decide to work with us and you do at some point decide to pursue hearing aids, we're doing a special offer. So when you do call our front desk staff, they have been informed to notate the code ringing. So when you do call up, say you went to the seminar and that you are utilizing the code ringing. We do hope to work with you. We really understand how debilitating tinnitus can be for many of you. And I see it each and every day. And as I said before, if you've seen one tinnitus patient, you've seen one tinnitus patient. So we do work with you individually. So we do hope to see you soon, that you can work with us and we can improve the quality of your life. Now, I don't know if we can do this unless Dr. Fuller has anything to add. Do you actually have a sound sample of fractals?
I don't have one handy on me right now.
Okay.
It sounds just like music. It really does sound like music. Like I said, it follows the properties of music. But we've poured a lot of research in it, and it's actually dichotic. So it'll go between both of the ears to really ensure that we're engaging the entire brain. But I saw that there are a few questions in the Q&A. We have a little bit of time
Sure.
to answer some. One of the questions that I saw on there was, can you use Zen if you don't have hearing loss? The answer to that is yes. If you have normal hearing, no hearing loss, you can still use a program like Widex Zen to help you habituate to that tinnitus.
Yeah, but just understand in terms of insurance, because of the fact that you might not have a diagnosis code of hearing loss, if your insurance does cover hearing aids, tinnitus might not necessarily be a code that will cover hearing aids. So just be aware, it may be an out-of-pocket expense to utilize that. We'll just go through some of them, Dr. Fuller.
Yeah.
All right. Let's see.
Here's one question. Is tinnitus in only one ear indicative of one cause over another?
Not particularly. No, we can have we can have 2 normal hearing ears. However, damage to those auditory pathways and sensory organs can result in just tinnitus in one ear. In fact, for many patients, however, they may have tinnitus in both ears. It just may be one ear is perceived as louder. However, if you do perceive tinnitus in one ear, we most certainly would like you to come into the office. We do want to rule out any sort of asymmetry. We do want to see if your ears are hearing the same or differently. If they are different, that would be something we would be focusing on, and we'd have to learn about why.
Mm-hmm. And why do certain foods make it worse or better? Make the tinnitus worse or better?
Do you want that, or do you want me to handle that?
Yeah, I could take it. So it just kind of depends on how your body reacts to that food. So certain foods like salty foods, fatty foods, a lot of those comfort foods, they make changes in the body to your blood pressure. Those types of changes to the body can change the severity of your tinnitus.
Yeah, so as I noted before about that bag of chips, the more salt, for example, intake, it gets more absorbed into the body, and that can cause possibly an increase in tinnitus. Also, our heavy wine drinkers, given we are at home a lot, everybody's popping those corks. So just be aware that a lot of alcohol can most certainly impact our tinnitus as well. So when we tell patients that, they're very disappointed. But yes, depending upon how much alcohol you intake, there is a relationship. Let's see.
Here's a question. Will taking a lipoflavonoid help decrease or eliminate tinnitus?
A lot of doctors are recommending lipoflavonoids. Personally, it's anecdotal in terms of success. Some patients will report that things get better. I put it just as a supplement, just like anything else. I don't see any personally, and this is just, again, this is my own opinion, not Dr. Fuller's, not the opinion of Coastal Ear, Nose, and Throat, but I don't find any sort of extreme benefit from lipoflavonoids more than any other supplement at this point in time. And the same thing with things like ginkgo biloba is another one. A lot of patients will ask me about ginkgo. I don't see any real uniform improvement in symptoms.
Let's see. My tinnitus gets louder as the day goes by, especially when I slouch in a recliner. Does that indicate anything in particular? This kind of goes into one of those kind of particular case questions, but one of the things that we should note is that sometimes your tinnitus will get louder throughout the day, and that could be because your stress gets worse through the day. You get more tired as the day goes on, so that can definitely impact the tinnitus that you hear.
And it's the same thing with hearing. I know this presentation is not necessarily about hearing, but for many people, they'll say, in the morning when I turn the TV on, I'm able to hear the TV at such a low volume. And by the end of the day, they always feel like they need to turn the volume up. And a lot of times it's because we're exhausted. Our brain has worked very hard in the course of a day. And whether we have normal hearing or not, we do have to rely on our brain to focus. So especially for those with hearing loss, there's extra effort. And that's why a lot of people will find that either their tinnitus will go up or their ability to concentrate, it's a lot harder.
Mm-hmm. We did get one question about the Zen Tinnitus app. There is a Zen Tinnitus app. It is free in your app store. It is different from Zen within hearing aids. So it is an app to kind of help you relax. It is really great for that because it can, provide you some sound to listen to. It has some relaxation strategies, some strategies to help you with sleep. So it is a great supplement. It is not the same as the tinnitus program that is within the hearing aid devices or the combination devices.
Right. And with that being said, obviously in assessing hearing, we want to focus on tinnitus and hearing. And for a lot of patients, the Zen app has been helpful, but it's most certainly not a substitute for a full comprehensive treatment plan for many patients that involves hearing aids as well.
Mm-hmm. Here's another question. Can tinnitus ever go away? Why does it just come out of nowhere?
Well, I guess the only instance where it can, I guess, go away, well, not the only instance, but an example of one that can go away is for sometimes patients will encounter sudden hearing loss. Now, I don't want to get too deep in what sudden hearing loss is outside of the fact that one day we wake up and our hearing is gone. For many of those patients, they will also experience something called oral fullness, where our ear feels stuffy or clogged, and they'll also report ringing, buzzing, hissing tinnitus. For a lot of those patients, if we can treat the sudden hearing loss, a lot of those symptoms can also be reduced as well. But if at this point in time, if it's a benign tinnitus, if it's there, for many patients, most of us, it will always be there.
Okay. And there are a lot of questions asking if this will be available, this presentation will be available, or if there will be any handouts from this. We can definitely, we are recording, so we will have the recording available for you to watch again. And, we'll have some follow-up with that as well.
But it's no substitute for coming in to see us. I know it sounds like an advertisement, but Dr. Fuller and I were talking before the presentation, and there's no substitute for in-person discussion. The reason is tinnitus is, as we've discussed, very emotional. And what happens is we want to see you in the office. We want to see how it is impacting you. Specifically, we do want to see how it impacts your personality, because we can see you from the beginning to the later stages. We can see where that improvement comes. And for a lot of practices, there are outcome measures and tests where we can measure whether you are in fact perceiving that things are better. So we most certainly encourage you to watch this again if you enjoyed Dr. Fuller and myself. But most certainly we'd like to see you in person. Let's see, we only have we have 3 minutes left at most before we start seeing patients. Dr. Fuller, any other questions that looked interesting? Because we can
Um,
only answer so many.
yeah, I think we really answered most of the questions here. A lot of the questions are very similar.
Oh, just a basic one. If I want to discuss treatment options for tinnitus, should I make an appointment with an audiologist, not one of the physicians? We do want to do that as a combined visit. It's important to see the audiologist as well as an ENT. We do want to look at it from the audiological/clinical side as well as the medical physician side. In the state of New Jersey, for example, we're not legally permitted to remove cerumen and wax. So if we do see that you come in for tinnitus and let's say you have wax, we would need the doctor to take care of that. So at Coastal, we use a team approach, audiologists and physicians working together. We do encourage that. Also, if there's something that we miss that the ENTs note or vice versa, it's a nice cross check.
Mhm. There are lots of questions about headaches and certain diseases and certain types of cancers. We just like to note that yes, a lot of these things are tied to tinnitus, whether that be through the treatment of those diseases or the disease itself. Again, that's another good reason to make an appointment to have everything assessed, take a look at and see if we can figure out what caused that tinnitus, and then take the treatment from there.
Yeah, and like even somebody put cardio bypass surgery. It depends on how your body reacts. Remember, the ear is just an end organ, and what happens is oxygen and blood flow have to make their way to the ear. So if we have a traumatic event, a lot of our elderly patients after a major surgery, their symptoms may increase. They may report that their hearing went down, their tinnitus went up. The whole body, obviously it's a body, it's a one big system with a lot of little parts. So just understand that, as Dr. Fuller noted, the answer to almost everyone is yes, it can.
Yes, it happens in tinnitus. Tinnitus happens in people young and old. It does not discriminate. It can happen to anybody. So just kind of keep that in mind. You're not alone, and there's a
Right.
lot of different things that can cause it.
And don't discount if your child is reporting tinnitus. I think a lot of times if your child is saying, hey, mommy, I hear something in my ear, there's a very quick dismissal. And we don't want that because one, there could be a change in your child's hearing, or there might be something else going on. So it's really important to have that assessed. Okay. And I think that'll be the last question we do today, Dr. Fuller, right? We've hit 1 o'clock.
Yes, it's 1
We did
o'clock.
a full hour. Just personally, I really enjoyed doing this. I obviously, if you do have more questions, please don't hesitate to schedule an appointment at Coastal. If you'd like to meet Dr. Fuller during one of our appointments, we can always bring her in either in person or remotely, obviously with our appropriate masks and whatnot. Yes. If you also have any suggestions for future webinars, we are most certainly willing to listen. I enjoy doing this. My wife, who hopefully has made it to the end of this presentation watching, I hope she says that I did a good job and I looked excited. I really enjoyed doing this. I think tinnitus is one of those things that's really, well, understood and misunderstood. And I hope this gives you the first step to a better understanding of tinnitus, and that if you need more assistance, we're here to help you.
Thank you very much for attending.
Have a good day, everybody.